All right. Now, this machine is called Datex-Ohmeda S5 Avance. So let's first familiarize with this piece of equipment, all right? Now, first of all, this ventilator is connected to the wall, which is the ceiling in this case, but you get the idea. It's connected here with several lines. And you have to remember, the white is the oxygen, black is the air, and yellow is the vacuum. This is the scavenger. Forget the blue now for a second. So, white oxygen, black air, yellow vacuum. As you see, these lines go back down here and connect to the ventilator. So in case we have a failure in the oxygen supply from the wall, we do have a backup system here. That's an oxygen cylinder, the backup ventilator. Just in case you have an oxygen failure, then you can open this cylinder and use that. Now, how does a ventilator work? Basically, it's a pump. You see this is called a bellow, and it's a pump. It pumps air, and it goes down like so. It pumps air into the patient's lungs. So, air and oxygen come from there. We mix them in the ventilator, in the circuit. The mixture of oxygen and the air comes here and gets pushed into this line here, and gets pushed through here, up there, up to the oxygen, up to the lungs. All right, and then patient exhales and goes through the other side of it, up to this line here, and then goes back into the circuit and gets pumped again in and out. So basically this is really how it works, all right? We have a mixture of oxygen and air, goes down to the ventilator, into the circuit. The mixture gets pumped into the patient's lungs and then comes back through here, and the cycle continues. Here you have an external oxygen supply that is not connected to the circuit. So basically, if you want to attach a face mask or a nasal prong from here, just go with the green line there and just open and close oxygen. This is a vacuum. Remember the yellow line? So here you have this chamber. It's the vacuum chamber that comes from the back of the ventilator in here, and up here that's the suction line that we use. Okay, that's a suctioning catheter, and then we switch it on and off from here. Right. Now, as you see here, there is a switch. There's a little sign of a bag and a symbol of a ventilator here. Now, these machines allow you to bag the patient manually. So you turn this to the bag, and then you can use the bag that is here to pump air into the patient's lungs. Or you can control switching this to the ventilator symbol, and then the machine then pumps air in and out. Okay, let's turn it on and see what happens. That's the switch on. And it has to boot there, so just gonna have to wait a few seconds. All right, so that's the first screen. It really basically asks you to check the machine. That's the first thing you should do really. So let's do that. Machine check. Press the green button. And here it prompts you. Switch back vent, switch to vent. Okay, so that means that you have to go here and put the switch onto ventilation mode. Open the patient Y. Well, the patient Y is this one. That's the patient Y. Yeah, I put it here. Okay, and then select start. Okay. And here you just have to wait a few seconds. Always keep this here. Okay. Always keep this switch up here. Okay. Make sure the bellows are fully collapsed. Let's have a look. There. The bellow, and it's fully collapsed. Occlude the patient Y. So I take this Y and I attach it here, conveniently there. Continue. You have to wait 2 minutes there, so I'm just gonna pause. Perfect. So now let's see what it says here. Occlude patient Y. Okay, it's already occluded. Set bag vent switch to bag. Okay, that's the bag. Set the APL valve halfway through between 30 and 70. Oh, this is the APL valve. Just have to turn it between 30 and 70. And you just click start. Okay. You will see the bag here starts to inflate. This is absolutely fine. It won't explode, don't worry. Now, perfect. We have done the check, or completed the check. All right. So now here is asking you another few checks to do, but basically really you just have to check if the suction is working, which it is, and then if there is an oxygen bypass switch working, it is working, and that's it. So you just go back to minimum here on the APL valve, you open it, and there you have it. You have a machine ready to deliver. So, okay, let's start now. Let's try to use it and see the different, ventilation settings that we might use here. All right, so from here, start case. Again, you go down, you move, you go up and down in the menu using the knob here. So start case now. Okay, so now here the machine is operational, and as you remember, the last thing we did was to put the bag here. So this is how it's working now. This is called manual mode. So if I want to use the manual mode, so I want to ventilate the patient with my hands using this bag here. Let's say this is the patient's lungs, all right? Let's put them up here. Okay, something like that. If I want to use this bag and pump air into the patient's lungs manually, first thing I want to make sure is that there is enough 6 liters. It's adequate. You can increase that a little bit if you want. You know, something around that value. Then you want to close this valve a little bit. So minimum means the valve is open, and maximum 70 here means that we're closing the valve here, and that means that if the valve is open, the air flows through it, and then if I press here, the air goes back here because this valve is open. So if I do this, the air goes back down, goes here, and instead of going to the patient, goes back into the circuit. If I close this valve and I press, you see how it inflates here? I press, the air goes from here, there, it finds a resistance, and then it goes into the patient's lungs. Let's see, for example, I have this thing here, put, let's say around 15, all right? I bag the patient by hand and look at the lungs here. There, okay. All right, so let's just go back to our ventilator main screen. It could appear a little intimidating here, but let's just explain the little numbers here. So this is oxygen, so that's the concentration of, the concentration of oxygen that you give. Let's call it concentration. This is the total flow. That means that 6 liters per minute is the amount of, or the volume of fresh gas that's coming from the wall and gets added to the circuit every minute. This is the tidal volume, which comes preset at 100 milliliters. So you're gonna have to change that if you're ventilating an adult, of course. This is the respiratory rate, inspiration to expiration ratio, and the P. Now here we're talking about volume control mode, okay? Obviously you have several ventilation modalities here. You can choose them by selecting ventilator setup. And then here you have several modes. You have volume control, pressure control, and others. So for the sake of simplicity, we'll just go with volume control mode, okay? That's what we want to do. So we go in volume control, and the volume control means that you control the volume that you give, you control the rate, you control the ratio, you control the PEEP, but you do not control the pressures that are generated into the patient's airways, because the pressures depend obviously on the volume and on the patient's compliance. So for the sake of simplicity here, we're gonna use always volume control mode. So we're gonna set our volume. This is the tidal volume. Okay, let's do something like so. And this is the rate. Let's select the P value. Okay. And the oxygen, you can change it up and down. Okay. Now, coming back to this flow, this concept is a little confusing, and I'm not going to go into detail of what the significance of this is, for the sake of what you're asked to do here is really to provide basic ventilation with volume control mode. Okay. Long story short, if you have a fresh gas flow higher than the minute volume of the patient, and the minute volume is the tidal volume multiplied by the respiratory rate. Okay, so if we have this number, the minute volume, smaller than the total flow of gas, that means that the patient is always kind of breathing fresh air and oxygen coming from the wall. Let's try to switch on the ventilator. So I just go down here and flip the switch to the ventilation mode and see what happens. Okay. You can see here that my lungs are inflating. Every cycle. Now, so now in this setting, I am giving this tidal volume multiplied by this respiratory rate, and that is giving me a minute volume of, 4.5 liters. Yeah, nearly 5, obviously, maybe more. There you go. Yeah, it has to calculate the average over time, so it takes time to go up to the actual value here. So this is kind of 6 liters of minute volume, and this is 6 liters of flow. This means that the patient is breathing always fresh air. So the air is coming from the wall, air and oxygen come here, 6 liters every minute, and the patient is breathing in and out 6 liters per minute. Now, if I want, I can reduce the total flow here to 2, for example. This means that every minute we are getting 2 liters of fresh air from the wall that are going to be mixed with 4 liters in the circuit, because then the patient is rebreathing his own air, to which every minute 2 liters gets added. So the patient is rebreathing 4 liters, and every minute there are 2 liters of fresh gas. Now, I'm only talking to you about this just to explain that this number has a significance during anesthesia. When we're dealing with intensive care unit patients, really, you don't really have to bother, deciding what kind of total flow you want. I would probably just set a random number and just go with it. Now, there are a lot of nuances to this, but again, I'm not going to go into the details and the real significance of this number into anesthesia mode. The bottom line here is that if we want to provide a controlled mode of ventilation, that means that the machine is operating and the machine is breathing for the patient, then we're gonna switch the ventilator to ventilator mode down here. And we're gonna go here and select volume control mode and set the values that are going to be indicated into our policy. Now, we have some numbers here. This is the peak pressure in the airways. Okay, let's go back here to the screen. The screen here shows a couple of curves. The first one is the pressure curve. Okay, so as you can imagine here, every time we push air into the patient's lungs, we have an increase in the pressure into the airways. And then, of course, when the inspiration phase ends, you have an expiration phase, and then the pressure then drops. And that's the pressure cycle over time. Here, you have the flow readings. You have positive flow when the air goes into the patient, and then when the air comes back from the patient into the circuit, you have negative flow. It's the direction of the flow. Positive is towards the patient, and negative is towards the machine. So really, this is the pressure flow, and this is the pressure curve and the flow curve. so that you're not intimidated by these curves. This is the mixture of gas that we're giving. So here we have 4 liters, and we're giving, all right, 60% or 50% of the oxygen. Then the machine will divide it 50% or 60% air and oxygen. Let's just leave it there now for a second. Anyway, coming back to these numbers, you have the peak pressure. So that's the peak here, okay? The peak pressure. The mean pressure is the mean pressure generated into the airways. Now here is not really reading the mean pressure; it's just making an average of the peak and the minimum pressure. If you want to read the real mean pressure, you want to go into ventilator setup. You want to go into the volume modes, settings, and you want to change the settings. You put a little T-pose here, okay? T-pose of, let's say, 20. Exit. Then the shape of the curve changes slightly, and then here, in a real patient, you will see a difference in the shape of the curve, and there you read the real mean pressure. Now, those are details. But if you want to read the real mean pressure, you want to have a little pause in the settings of the volume control. Okay. So this is the PEEP number, which is usually the same PEEP number that we set. The respiratory rate, that is usually the same one that we set in a volume control ventilation. And then you have other numbers here. Those are readings that come from the patient if the patient is attached to the ventilator. Here it will give you the CO2 that is coming from the patient, and the entitled oxygen that is coming out from the patient. So anyway, this is the screen. This is the modality, volume control. You're gonna have to set the volume, the rate, the ratio, and the PEEP, and we'll give you all the numbers, and we'll create a policy for that. And those are the numbers and the meanings of these numbers. So really, what you want to do when you are ventilating in a control mode, really the core things to remember are the oxygen, the tidal volume, the respiratory rate, the PEEP, and that's all you have to really focus on. If the patient is breathing, or is triggering, we call it in the business. So if the patient is making efforts to breathe, so then the machine no longer needs to control his lungs functions, then we can choose to change the modality from completely control to something we call PSV Pro. Okay. So this is a, all right, so let's go back, to the PSV Pro there. PSV Pro ventilation, it's a pressure support modality, okay? What does it do here is that whenever the patient makes a respiratory effort, so triggers, as we call it, as I said in the business, the patient then tries to take air in. That effort is sensed by the sensors, and the machine delivers a certain amount of pressure behind the patient effort, and then delivers air into the lungs. So let me just show it to you so that you understand it better, because it's a little confusing if you're not familiar with this concept of pressure support. So this is the lung. You look at the monitor and look at the bellow down there. Okay, so this is the lung. If I try to make a respiratory effort, so expand my lungs, the machine will come. Oh, actually, sorry. I have to switch. That's very important. You have to put this onto ventilation mode. All right. typical mistake. But it's good that you've seen it, so you remember now that whenever you put the PSV Pro, you have to flick that thing to a ventilator. So you have your lungs here. I want to make a respiratory effort, so I expand my lungs, and the machine comes after me. So I expand the lung, and the machine pushes air into the lungs. Expand the lung, and the machine comes after me. You see? There you go. So here, whenever the patient makes an effort, the machine comes after the patient with a pressure that you set here. Okay. So basically, you want to set the amount of pressure that is required to generate the tidal volume that you want to achieve. Let's say you want to achieve 450 milliliters of tidal volume, then you're gonna have to set your pressure support to a degree, to a number that allows you to achieve that. Okay, now it's gone into backup mode, so forget about it. But that's the story. There are two modalities that you really have to deal with in case you're asked to look after a ventilator of this nature. You're gonna have to control the ventilation with volume control ventilation mode if the patient is not triggering. But if the patient is starting to breathe or is breathing in a way and you just need to help them, you're gonna have to put pressure support modality, and in this ventilator is called PSV Pro, and you just have to set your pressure support to a number that gives you an adequate tidal volume. All right, so I think that's pretty much it. Sorry, that was a long video, but I kind of covered a bit of everything here. And I think really the two volume control mode and pressure support mode are going to be the two modes that we're going to use during this crisis, should we have shortage of anesthetists around the place. Okay, thank you. See you later.